So this is the fitness report. Now, I took this test the other day, and there's all kinds of modalities that I can use for this test depending on what your preference for exercise. It can be running, it can be rowing, it can be on a bicycle. I have a walking treadmill workout routine that I've been using for decades that is very efficient for people trying to do body transformations, and it's also useful for people who have any type of joint problems. So I don't want to have them putting a lot of wear and tear on their joints with the pounding of running, or if they're overweight and they want to bring their weight down before they start doing any running. So this is a treadmill workout that I did, and this was just done a couple days ago. And let's come down here, and you're going to see all the information that this test is going to be giving me. So here's a little overview. It's just telling the areas that we're going to be getting information from this simple 12-minute test. We're going to get some information on my breathing and cognition, my aerobic fitness, my cardiovascular fitness, my recovery capacity, my capacity for high intensity performance, my respiratory capacity, my respiratory capability, telling me about my lungs, my breathing stability, so we're talking about down in my diaphragm, and then also fat burning efficiency, mechanical efficiency, and metabolic efficiency. That's actually going to be giving me a gauge in terms of within my muscles, how capable are they of producing energy, mitochondrial density, and so forth. So here are my results. Aerobic health was off the charts at 100%, which is probably the most important measurement, in my opinion, from this test as a medical doctor, because this is a really good measurement of your overall cardiovascular health and gives you a little window into possible longevity from this number. But there's also a cardiovascular fitness metric, which I'm at, well above normal at 79%. Respiratory capacity. Now, this is a measurement of my lung function, which was done right before the fitness test using a spirometer. So this is before I started exercising. I want to know if I have a breathing problem, whether it's something that's in existence before I start exercising, or if it's something that shows up once I start exercising. And you can see here that at rest, my respiratory capacity is excellent. But then look at this, respiratory capability, it goes down to 49%. So already I'm getting some valuable information here about things I can work on. Even though I'm fit, even though I have great aerobic health, I can make this even better and improve my performance if I address these things here that are suboptimal. So respiratory capability, breathing stability, both at about 50%, breathing and cognition at 30%, metabolic efficiency at 50%, fat burning efficiency is really good here at 88%, high intensity performance. Now that has some room for improvement, and that's probably because of the respiratory issues right here that I need to address, and that'll help my high intensity performance even though I have good aerobic health. Mechanical efficiency 100% and recovery capacity 52%. Now all this is explained in the assessment, and what's really cool about the report that people get is that each one of those metrics is explained, and then also there's something that tells you how to address it. So for my aerobic health, so back up here 100%, but everybody's not going to be at 100%. It says this metric represents your ability to exercise at high intensities. Aerobic health is one of the best indicators of overall health and best predictors for developing cardiovascular disease. The value of this metric is based on VO2 peak, the maximum amount of oxygen you can use per kilogram per minute and achieve during your test. A sedentary lifestyle, lack of cardiovascular exercise, or excessive weight training will lower this score. And then it tells you what to do about it. Cardio and interval training will improve the score of this metric. So they do that for each of these measurements, which is really awesome. And I won't go through that in detail now. I'll be doing a separate video to get really deep into these two different tests, but I just wanted to give an overview. But you can see here that they explain each of the metrics. Okay, but that's not it. So if we keep going down, next it's going to give me a workout programming which is a recommendation of how I should allocate my time based on my test. So you can see here that it's telling me that I need to allocate about 40% to resistance training, not much to basic cardiovascular training, because I already have a really good metric for that. But look at that, 50% do some interval training, and that will address the issue that showed up above in my respiratory numbers. And it says right here, due to respiratory limitations identified in your report, we can recommend that you add respiratory training to your weekly training schedule. The type, intensity, and frequency and duration of respiratory training will be specific to your limitations. So now, here's the amazing part. So it also is going to now give me my training zones for this particular exercise. And, you know, why this is so important is that a lot of people are utilizing tools now to measure their heart rate, including like an iPhone and you know, the Fitbit and the Garmin and the Whoop, and there's so many things that are telling, and Polar too, Polar heart rate, and they're all telling you, you know, what your heart rate zones are, how many beats per minute, and all this. And the problem is, none of them are accurate when it comes to zoning, because none of them are actually measuring you. So this was really helpful for me, and it showed me a lot. So what this is doing is telling me each zone, what my heart rate should be to get me into those zones. It's also telling me my benefits and also training types in terms of what to do in those zones. So that's some awesome information. Keep going down here. It's telling me at how many beats per minute I'm burning the most fat. Excuse me. It's also telling me my VO2 peak as well as my ventilatory threshold, which is the intensity at which physical activity starts to be considered a workout. That's at 121. And even that's important, so that, you know, if I go out and I'm strolling along and thinking I'm exercising, just because I'm doing some movement and I'm not above 121, it's really not making me do much work. Okay, and that can be valuable for some people. Down here, it's telling me my fuel usage at each heart rate in 5-beat increments. So you can see that when I start working out here and my heart rate's in the lower 115, 120, 125, I'm burning about 600 calories per hour. And it even tells me the distribution of fat burning versus carb burning. And of course, at a very low intensity, I'm going to be burning more fat than carbohydrate, a lot more. And then as I increase the intensity, you see the calories going up, but you also see a shift from my percent fat being burned to percent carbohydrate. I'm at about 50% at 160 beats per minute right here, and then it switches over, and then you can see when I'm really pushing myself at a heart rate of 180, excuse me, the percent fat, now I'm not burning any fat, I'm just burning carbs, but I can't sustain that long. That's almost like sprinting, or, that's at your limit, your peak. But that's very useful information. And so hopefully that gives you some type of idea. Now I am going to be doing some more in-depth analysis of each of these tests. I didn't want to make this video too long because you see there's a lot of information here, but I do get questions about which test is valuable for what reasons, so I just wanted to make sure people could see that. So I hope this was helpful, and if you have any questions, just put them in the comments.